So it is something that we need to have a good understanding of. So when we talk about arthritis, essentially it is inflammation of one or more of our joints. Now, when we're talking about inflammation, essentially you can think of a situation where things are, well, think of fire. Fire is a good concept when you want to think of inflammation. So you know you may have paper or trash or something burning, and if you set that on fire, there is a flame. And usually that flame has a redness around it. There is heat. And of course, if you get too near to it, it's going to cause pain. So what inflammation is that the joints, essentially, you can think of it like being on fire. Now, it's not a raging fire. It's maybe a more smoldering fire, but it is there. And you know that something is wrong. And usually you can see that associated with that, there may be redness, there may be swelling, there may be pain, there may be a feeling of heat in the area. And usually what is happening is that there is some reaction to injury or disease or some irritation of the joint. So if we understand that it's this inflammation that's causing the problem, then we have a better idea as to why persons are feeling those symptoms. Now, if we are to understand what is happening, it's good if we get an idea as to the joint structure, right? And most of us have seen bones. We may not have seen the human bones, but we have seen bones from other animals, etc. And we can see where there are joints in those bones. And essentially what happens is that if we understand that it's important that joints occur, because joints connect as well as separate bones. So one, you need the joints to be connected so they can move one against the other. So it facilitates movement, but you also need some level of separation, because if there's no separation, you can imagine that if bone is rubbing against bone, then you can now begin to see the fire occurring, because when you rub things against the other, you get friction. And certainly in the old days, how we would start a fire is actually using friction to rub stones together until there's a spark, and that spark causes the fire. So if the bone is rubbing against each other, then you can expect that something is going to be happening, and the joints therefore help to separate the bones as well as to join the bones together. Now, how is this done? So firstly, there is a lining on the bone. We call this a synovial membrane. Right, so this is this lining on the bone, and the lining on the bone secretes a fluid into the joint, and that fluid in the joint separates the joint. So you can see it on the figure that in that middle portion there is fluid. At the edges there's a synovial membrane, and also the edges of the bone usually have a layer of what is called cartilage. And the cartilage is made up of a more jelly-like substance, and therefore it doesn't create the same amount of friction as regular bone would. So what happens is that when we have arthritis, there is some breakdown of the bone structure. And that breakdown of the joint structure, and that breakdown of the joint structure results in pain. It results in swelling, redness, stiffness, and loss of function. So we can go to the next slide. Yes, that's good. So what we have demonstrated here is that in the figure you have a normal joint, and this would be on your left. I think so. Right. So the normal joint is there, and then beside that you see the two abnormal joints, one affected by what is called osteoarthritis, where the bones are beginning to rub together, and another which is called rheumatoid arthritis, where there's primary inflammation and destruction of the joint. But essentially we want to point out that when arthritis begins to set in, the symptoms include pain, swelling, redness, stiffness, and loss of function. So in terms of, there are two main types of arthritis. The osteoarthritis, we call that, or OA, and that one is usually due more to destruction of the cartilage that in the joint, and therefore you get loss of space in that joint and the bones begin to rub against each other. And then rheumatoid arthritis, we'll talk a little bit more about both of those later on. There is primarily inflammation. You can see here lots of redness and some destruction of the edges of the bone. Now there are several other causes of arthritis. So it's not just osteoarthritis and rheumatoid arthritis, but those are the common ones. Also, infection in the joint. You can get an infectious arthritis, and we call that a septic arthritis, and that one usually requires treatment with antibiotics and so on. But that tends to be more an acute illness, so it's short-lived and usually not something that's going on for a very long time. Another relatively common type of arthritis is due to what is called gout. And with gout, what happens is that there's excess amounts of a certain protein breakdown product called uric acid, and that forms crystals in the joints, and then that can also cause arthritis. But the ones that most persons will see and experience is going to be the osteoarthritis. So here we speak a little bit more about osteoarthritis. It's the most common form of arthritis, and what happens here is that there is wearing away of the cartilage that caps the bone. So remember we spoke about that gelatinous substance that's at the edge of the bone. Now as that becomes worn down, then the bones then begins to rub together, and that sets up this whole inflammatory process. And because of the nature of how osteoarthritis occurs, then it tends to affect the weight-bearing joints more than some of the other joints, but it can affect other joints as well. So the joints that tends to be commonly affected will include like the knees and the hips and so on. Now, with rheumatoid arthritis, there is the synovial lining, that membrane that lines the bones, becomes inflamed, and it secretes excess amounts of fluid, and then there's breakdown of some of the other joint structures. And then that is usually due to what we call an autoimmune process, where your body begins to produce proteins that damages its own cells. And therefore, that tends to be a more florid type of arthritis, and it can affect several other organs and tissues, and certainly something that we prefer not to have, but of course if we have it, then we deal with it. Alright, so we're going to spend a little bit more time talking about osteoarthritis. As we said, that is the most common type of arthritis, and that's what most persons will experience. We pointed out before that initially what is happening, the cartilage wears down, and as the cartilage wears down, then the bone starts to form spurs. Right? So these are little pointed edges on the bones, and you can see that on x-rays, and sometimes you can feel it under the skin. So the joint surface itself becomes irregular. And of course, what is happening now with the breakdown of the cartilage, the bones begin to rub together. And then the symptoms, pain, stiffness, loss of motion. You can't move the joint the way you would want to move the joint. Or whenever you move that joint, there is pain and difficulty. Sometimes there's a change in the shape of the joint. And therefore, you can understand that if this is beginning to occur, then you're going to get loss of function. As we pointed out, that with osteoarthritis, it tends to affect the weight-bearing joints more commonly. So the knees and the hips, as also the back, becomes an important area. But it can also affect the hands and other areas as well. But predominantly, persons suffer from knee pain, back pain, hip pain, etc. And of course, if you also get wear and tear in the neck, that one is also very important because it carries a risk of compression of the spinal cord, and that ultimately can lead to paralysis. So it's certainly not something that one wants to ignore. So it can have serious consequences, but again, what we try to do is to deal with it as it comes. Now, on this slide, we're trying to illustrate the breakdown of the cartilage, and you can see the one on your right, I hope, but anyway, the one that looks nice, that's on your left. All right, good. That one is normal. The other one, you can see the breakdown. You can see those spots in the cartilage. And then, of course, when that begins to happen, you know there are problems occurring. Now, what are the risk factors, or who are the persons who are more likely to develop osteoarthritis? Now, the most significant risk factor is age, because one of the issues is wear and tear. Right? I know wear and tear is going to accumulate over time. So it tends to be relatively rare under 40. But then as well, in terms of as persons get older, it becomes a lot more common. Some persons have more symptoms than others. Now, one study suggested that if you look at x-rays of persons 55 and over, up to 80% of those persons will have abnormalities on the x-rays, even if they do not have symptoms of joint pain and swelling. So it is very common. Women tend to be affected more than men. Not quite sure why, but women are 2 to 3 times more likely to be affected than by osteoarthritis than men are. Then with obesity is another major risk factor, and we can understand here again that if the knees have to carry more weight around, then there is more pressure on the knees, there are more pressure on the hips, and therefore the more weight that one carries, the greater your risk of damage to the joints. So one of the things that we'll talk about later on is that weight management becomes an important tool as we try to prevent or minimize the risk from osteoarthritis. Now, certain occupations put persons at risk because the nature of the occupation means that you're on your feet often. Sometimes persons are doing specific bending procedures, and that will put more strain on particular joints. So what is found is that persons whose job involves bending and kneeling tend to have more knee osteoarthritis, whereas persons who work like in construction and in farm areas, often involve heavy lifting and so on, tend to have more hip osteoarthritis. But again, it is not confined to those occupations. Persons will do their regular occupations and may still experience a number of these symptoms. Persons who participate in sports also can have significant osteoarthritis. And this is one where we tend to see persons developing the arthritis much younger. So when there are contact sports, jumping sports, sports that put a lot of pressure on the joints, then those tend to cause a lot more joint damage, and those persons will develop symptoms sometimes much earlier than persons who do not have that type of exposure. Again, not that you shouldn't play sports, but then you should be aware of what the risks are, and then you can take some precautions as much as is possible. Now, a little bit more on the symptoms. So we mentioned that you will get pain. And usually this is pain that is worsened by activity or movement of the joint and relieved by rest. So most persons with osteoarthritis, if they're sitting, not doing much activity, they tend not to have a lot of pain. But with severe cases, persons may experience pain even at rest and during the nights. And of course, you know, that may cause problems sleeping, and a lot of persons, the night pain is what bothers them most because it disturbs their sleep. Other things that sometimes it may be tender to touch. So touch the joint and persons will scream because there's that amount of inflammation and pain. In addition to the pain, there's often stiffness. And the stiffness is usually worse in the mornings and tends to wear off as the days progresses. But then sometimes other persons report that there may be variations with the weather. So particularly like in the cold times, persons sometimes often experience more pain. There may be significant amount of swelling. It varies, so sometimes you may have a lot of swelling, sometimes you may have a little bit. And usually the swelling is due to the accumulation of excess fluid because of the damage to the membranes that, that's lining the joint. And additionally, persons may have a crackling or grating sound when you move the joint. So it's called crepitus. So with that roughened surface, normally you bend your elbow, you bend your knees, and it's nice and quiet. All of a sudden you start hearing sounds when you move the joints. And if you start to hear those sounds, then you know that you have problems. So even if you're not having pain and you begin to hear the sounds, you need to begin to start taking precaution because there is some damage there. And then there may be these bony outgrowths we speak about when the bones begin to rub against each other. Then there is spurring and these little areas that you can sometimes feel under the skin because of the abnormality. So those become the sort of a major symptoms. Now other persons may have differences in the way in which it presents, but most persons will have some or all of these symptoms. Now the next thing that one has to look at is how do we make a diagnosis? So somebody comes, they're having pain, how do we know that this is osteoarthritis? How can we confirm the diagnosis and then begin to proceed to treatment? Now the symptoms are sufficiently typical that most times we can make a clinical diagnosis, which means that the doctor takes a history from you, so ask you a lot of questions, and then does a physical examination. So if we ask about the swelling and the pain and the stiffness and the redness and the loss of function, and you give the full story, then clearly that suggests that this sounds like possible osteoarthritis. And we examine the knees or whichever joints, and there's some swelling, there's tenderness. When we begin to move it, then you begin to hear the crepitus. You know what you're dealing with, and you can proceed to treatment. However, it is often useful to get some additional information, because one of the important things that we also want to rule out other causes that the treatment may be a little bit different. So the clinical features is usually good enough to make at least a preliminary diagnosis. In many cases, we would want to do x-rays, and x-rays will be able to confirm the narrowing of the joint. It can show the erosions in the joint. It can also show where there are spurs and so forth in the joint. So x-rays are an inexpensive way to assess whether or not there's evidence for arthritis. But in the early stages, the x-rays may be normal. So we can't say that because the x-ray is normal that there is no arthritis. So until you have gotten to the point where the joint spaces are narrow and you can see those spurs, etc., you may not be able to make a diagnosis on x-ray alone. Now, in some cases, you may need to do more comprehensive tests like an MRI, and this is particularly relevant when it is affecting the back, because the nature of the spine at the back means you don't see as much in the x-ray, and more critical, in the spine you have nerves that are coming out between the bones, and running through the center of the spine is your spinal cord. And usually what we are concerned about, well, the patients are most concerned about the pain, but because you have a better understanding as to what the risks are, then I'm always concerned about the spine. And therefore you want to know whether or not there is any evidence of any compression of nerves or any pressure on the spinal cord. And sometimes you can pick this up from the examination, so you may see specific muscle groups that are not working very well, and that will tell you that there seems to be nerve damage here. And then if you suspect that there is nerve damage, then you would want to do an MRI, because the MRI will give you more detailed information and will allow you to say if there is or there is not compression of the spinal cord or compression of nerve. So the MRI gives additional information, but it is not to be done on every patient, because it's not necessary for all patients, and also it is very expensive. So, but just for you to know that those are some of the things that are done. Now, in addition, we will often do laboratory tests. And the laboratory test usually is not so much to make the diagnosis of osteoarthritis, but to look for other things. So sometimes, based on the presentation, say it's affecting the hands, we may not be very sure if this is rheumatoid arthritis or this is osteoarthritis, and we will do some specific lab tests that will help us to point us in one direction or the other, because the treatment is very different if it is not osteoarthritis. So, moving on, so let's talk a little bit about treatment. Now, the treatment can be divided into subgroups. So we have what I would describe as supportive care and lifestyle changes. Then there's physical therapy. There's a possible role for supplements, although this is disputed by some. There is a definite role for medications. And if medications are insufficient, then there are surgical therapies available. So we're going to go through each of these and try to clarify what we would want to do. So the first line of care usually is our supportive care and lifestyle changes. And rest becomes important because the symptoms are worsened by activity. So if you have knee osteoarthritis, you don't want to be walking up and down in the market every single day, carrying how many bags and how many things, and hurt up your knees and then go home in pain. Right? So one has to manage your activity. So we don't want you to lie down in bed all day, because that is just as bad. Right? But we want you to now manage your activity, get adequate rest, and then you can work out scheduling like the various tasks, so that you don't have to do everything on the same day and put your body under undue stress. So for the seniors, what I would say is that you can't do everything the same way you were doing them when you were 20 years old or 30 years old. You may feel young in your mind, right? But then a little dose of reality is usually good. So don't try to do everything the same day. Schedule your activities. Work it out. Do something today, get some rest tomorrow, do something the next day. Because when you're in pain, it is distressing to you and to everybody else in the family. Right? So it's important to look at that. So getting adequate rest and managing your activities certainly would be wise. Other things that would well, we'll come back to that in a minute. So also very, very important is weight management. And this one, unfortunately, is easier said than done, but it has to be said, and we're going to work until we get it done. All right, so in my practice, it's one of the bigger challenges. You know, I feel very confident that I can get blood pressure down almost all the time. I can get the diabetes down once you're willing to work with me. The weight is a little bit more of a problem because most people don't work with you. They do their own thing. And of course, sometimes they go to the dietitian and then they throw away the diet sheet. So weight is a challenge, and unfortunately, we really don't have any good medication for weight loss. So we have to work with lifestyle management primarily. So the first thing is, if you're overweight, start trying to work on losing some of that weight. Right? Now, how are you going to lose the weight? It means that you have to take in less than you're putting out. And now that becomes a challenge for seniors as well, because if you had a fairly active lifestyle before, You often eat to match that lifestyle. But suddenly, you're no longer as active as you used to be, and then you eat the same way that you were eating when you were active. And you know what happens then? You begin to put on weight. So what we have to begin to do is to ensure that we match our eating with our lifestyle. So Usain Bolt can eat 4,000 or 5,000 calories in a day, and he'll be fine because he's burning it off on the tracks. But if I eat 4,000 calories a day, soon I'll have trouble coming through the doors. All right? And we have to understand that. And it is easy to get all of those calories because you take a slice of cake, some pastry, some juice, and all of these are extra things, you know, not our regular meals. And easily you can get an extra 1,000 calories without thinking about it. So what it means that we have to think about what we eat. We have to begin to read labels. We have to begin to count calories and ensure that we are not consuming too many things. Right? And so, again, the other thing is that you're at home. The food is in the cupboard. And, of course, when that happens, you know, you get bored, you just go get something to eat. So it's important that you think about it and manage it. Now, in addition, there is need for exercise. Right, so you have to begin to do some exercise. And with that, it's important that you understand that you, well, it means usually getting up out of the house and doing some things. A lot of people count housework as exercise, and it is exercise, but what I say to most patients, you've already adjusted for the housework that you're doing. You've eaten enough to cover the housework. So if you really want to lose weight, you have to be doing something extra, something that you were not normally going to do. So I often recommend that you get out the house, go for a walk in the mornings. 30 minutes is good. If you can do an hour, that's even better, right? It doesn't have to be jogging or running. A brisk walk is good enough. All right, and again, if walking doesn't put so much strain on the joints as say jogging and running does, so it is better if we're thinking about preventing arthritis. So getting up and doing some exercise clearly will be an important aspect. The other thing that one needs to recognize that it doesn't have to always be a long bit all the time. If you can do 10 minutes or 15 minutes 2 or 3 times a day, it adds up. So not because you can't find a half an hour free, don't mean that you should not be doing any exercise. And of course, in addition to the aerobic type exercises, there's a role for muscle strengthening exercises. So the stretching and the weights, etc., should be encouraged. But again, for that, one has to be a little bit careful because sometimes if you're not doing it properly, you may also get more injury, and more injury is going to lead to more problems. So it has to be monitored. And usually, if you're going to be doing significant weights and stretching exercises, it's good to have some guidance from somebody like a physiotherapist who can say, you use this, you use that, you do this particular stretch, you do this particular bend, you lift this amount of weight, and therefore there is a plan rather than you just getting up and doing things of your own whim and fancy. So it's important that if you're doing the weight training and so on, that you have some guidance. But generally for the aerobic type activity, once you are generally well, that's something that you can do without having to do too much supervision. Clearly, if you start walking, you start getting shortness of breath and chest pain and all of those things, then you're going to have to back off and go back and see your doctor. All right, so don't push it through and say, oh, you know, because you may be exerting yourself too much, and that can lead to other things. So it's important to understand that. So exercise is very, very important. And then we spoke about weight management and so on. Now, physical therapy is another important area. And this starts with simple things like walking supports. Now, we have a number of our seniors who refuse to use their walking aids. because they don't want to feel old or look old. And therefore, one of the things, put it this way, if you've gotten to 60 or 70, you've earned it. Right? Nobody can say anything to you because you walk with a cane. This is your badge of honor. Right? A lot of people don't make it that far. And therefore, you have to change the mindset to say that if you need an aid, then use the aid. Right? So don't suffer unduly because of pride. Right? So it's important that we understand that a lot of times the relatives come and say, we buy the cane, we buy the walker, and they're not using it. Right? So please, if you need some aid, use the aid, because it will improve your mobility, it will improve your functioning, and you will do better in the long run. What sometimes persons end up doing is that they don't move, they just not do things because of the pain, but then that is not helping. You still want to maintain your independence, you still want to be able to do the things that you would normally want to do, and if some aid is helpful, then that should be considered. Other things that can be looked at would be like braces to support specific joints. So sometimes a knee brace helps to stabilize the joint. You can use splints for the arms or wrist and so on. Again, a lot of these, it's good to have guidance from a physical therapist, because sometimes you may be doing it incorrectly. And if you're doing it incorrectly, then you may not get the maximum benefit. Now, a lot of people are interested in hot packs and heat therapy, and there is some evidence that it does produce some relief, but one has to be careful because it can also cause burns. Right? So one has to be very, very careful. Whatever you're using, go through the details, make sure the things are not too hot, monitor what you're doing, don't put it on and go sleep, because you may wake up with a big burn on your body, and that may be problems, right? So it's important to understand that. And then cold therapy may also be helpful, like ice packs, coolant sprays, and so on. These tend to be used a lot more in acute injuries, but there seems to be a possible role in the more chronic arthritis as well. Now, a little bit about supplements. Now, a lot of people like supplements. The challenge, though, is that the evidence to support the benefit of supplements is relatively weak. So we don't necessarily recommend that people should not use supplements, but don't hang all your hats on these supplements. And there are lots of people selling all kinds of things. Some are good, some are bad, and some are useless. Now, you have to read up about it. And I usually say to my patients, if you're taking something, let me know, right? I can look at it. I may have to go and read up about it too, because I wouldn't know all the things that people are using as alternative therapies. But it's important that we understand that. But there are some that may have some benefits, and but the evidence is still not conclusive. So some of the commonly used supplements include things like glucosamine and chondroitin, and these are often together in all of these joint support supplements that are on the market. But again, as I said, it may be of benefit, but don't hang all your hats on that. Vitamin D has been recommended by some. Vitamin D is generally good for bone health, in particular when there is thinning of the bones or osteoporosis, which is different from the osteoarthritis. So osteoporosis increases the risk of persons developing fractures, and therefore, even if it's not too great for the joint pain, it would be a good idea to take your vitamin D anyway, because that will help to strengthen the bones and decrease the risk of fractures. And certainly in older women in particular, hip fractures are a major challenge, and often there is a downhill course after a hip fracture, because the person loses function, becomes immobilized, and there are so many other problems that can occur. So the extent to which we can prevent these becomes very, very important. And as we mentioned the issue of the fractures, this is again where the walking aids become important, because one of the major challenges among older persons is the risk of falls. Because in addition to the pain, there's often problems with balance. And if you're having pain and you're having issues with balance, then you may fall. And if you have thin bones and you fall, the bones are likely to break. And as we explained, broken bones in older persons is, while they can be fixed, it's not a very good thing to have. Sometimes persons have to be stretched out with their feet being hung up with some weights, we call it traction, in bed for weeks and months. Not a good idea. The alternative there is to have surgery done, but in our public system, getting to surgery is not the easiest thing. And in the private sector, it may be quite expensive. So the moral of the story is, as much as possible, avoid those hip fractures and other fractures. There's also a potential role for fish oils, like the omega-3 fatty acids and so on. And again, it should help the joints. The evidence is not as strong as one would like it to be, but there's also benefits for heart disease protection. So overall, I would say that certainly for vitamin D and your fish oil supplements, it's good to take anyway, because there may be multiple benefits. So even if it's not the greatest thing for arthritis, you may be strengthening your bones and you may be helping to reduce your risk for heart disease. So there are potential benefits for those specific supplements. Now, where your physical therapy and lifestyle modification, supplements, etc., are inadequate, then there's a definite need for medication. And medications are not bad. And I want people to understand that. I think a lot of patients, they have the habit of counting the medications. And they say how many pills they're taking, and they say, you know, this must be bad for me. Now, yes, we know that medications may have side effects, but if you are working with your doctor and they are prescribed appropriately, the benefit is going to be better than not taking them. Now, of course, if they are not prescribed appropriately, which usually means either information wasn't provided or persons didn't listen appropriately, it can go both ways. So if you get an incorrect medication, then you're not really going to get the benefit. You may be getting the side effects. So that is something to think about. But the general thing is that if you're working with your doctor and you have appropriately prescribed medication, it is always best to take them. Now, then sometimes you can discuss with the doctors which are the ones that you need to take every day and which are the ones that you may take when necessary, and have a clear understanding as to what the differences are. So in terms of medications for arthritis, we have the basic analgesics, so these are painkillers. And with the analgesics, then they relieve pain but do not have specific effect on the inflammation. And therefore, it is not correcting the underlying problem, it's more dealing with the symptoms. But if we understand that symptom relief is our goal, then that is a reasonable approach, especially for milder forms of arthritis. So paracetamol is our base. So the common brands include Panadol, Cetamol, etc. And these can relieve mild to moderate pain. There's some debate as to how effective paracetamol is for osteoarthritis pain, but a lot of patients will report some benefit, and therefore it is something that can be used. It's important that it's not be overused, right? Because high doses of Panadol can cause things like liver damage, etc. So one has to be careful. So the maximum allowed dose is about 4 grams or 8 tablets per day. So we don't want taking 2 to 4 tablets per day is reasonable. When you're getting towards the 6 and 8, you have to think about it, especially if you're doing this on a long-term basis. So it's important to understand that although it's an over-the-counter medication and that you can buy as much as you want, it would be unwise to take in excessive doses. Now, often what is done is that we try to combine the paracetamol with some stronger analgesics, but in low doses, because the more potent ones tend to be associated with things like abuse and dependence and so on. So certainly if you're listening to the news, you hear about all of these pain addiction, or addiction to pain medication in the US setting. And this becomes a major problem because people really develop dependence on them. We try to avoid that, and the ones that are tend to be used, the risk of dependence is very low, again, especially if used in low doses and not very frequently. So codeine is, when combined with Panadol, it's called Panadine, and there's a regular Panadine and there's the Panadine F, which is a stronger version. And usually if the Panadol isn't working well enough, you can use some of these as additional aids, and it may make a difference. Tramadol combined with paracetamol, the brand is called Tramacet, is another commonly used combination, and is usually quite effective. One thing to note though, that often when we're using these combinations, it may cause drowsiness. And sometimes we explain to the patients to start with one tablet first rather than two, because sometimes if you take the full dose at the get-go, then then persons may become very drowsy afterwards. But after you get to know how the drugs work within your body, then you can moderate it a little bit, and you'll know what is an effective dose. Again, work with your doctor to make sure that you're not overdosing. Another group of drugs that are commonly used in treating the osteoarthritis would be what is called the NSAIDs. And this NSAID stands for non-steroidal anti-inflammatory drugs. And you don't have to remember all of that long name, right? The main thing is just to know that this is a particular class of drugs, and there are some important things to note. So the common ones that belong to this class would include things like aspirin. Now, another distinction that needs to be known is that the aspirin that people take to prevent heart attack and stroke, or the low-dose aspirin, is not going to be really effective for pain because that dose is too low. So it's usually the full-strength aspirin if persons are taking aspirin for pain. Other over-the-counter options would include ibuprofen or Advil, Aleve, which is naproxen, and these, of course, you can just go into any supermarket, or pharmacy rather, and you can get these, and there are instructions that you would follow as to how to take. Again, it's important not to overdose, and very important to note that all of these non-steroidal anti-inflammatory drugs can be harsh on the stomach. And we're going to say a little bit more about that. So persons who have stomach problems, peptic ulcer disease, acid reflux, etc., has to be very, very careful how you take these medications, because you may have significant side effects. So even if although it's available over the counter, it is not something that you should just take without thinking. And it has other effects that one needs to be concerned about. It can cause increase in your blood pressure. There's some risk for kidney problems as well. So again, taken occasionally without the doctor's prescription is reasonable. But if you're having significant pain, it's something that you should be discussing with your doctor, and ensure that at least your blood pressure control is good, that your kidney function is normal, so that you're not doing ongoing damage and not thinking about it. So some of the more potent NSAIDs in this class will require a prescription. One of the commonly used ones is diclofenac or Voltaren, another preparation of the same drug called Cataflam. And then, as we pointed out, that in general, that these NSAID type drugs, so aspirin, Advil, Aleve, your Voltarens, etc., all carry the risk of causing stomach pain and may also cause bleeding. And of course, the bleeding sometimes can be severe, requiring admission to hospital and so on. It will not happen in the majority of patients, but it's important that you are aware, and that certainly persons who are at higher risk should be very, very careful about how you take these agents. Now, additionally, there are topical gels. So these are products that can be applied to the skin in the area of the joint. So like there's Voltaren gel and several others. And these are usually relatively good. So persons can use this as an option instead of the tablets initially. And the risk of side effects will be much less if you're using the gels as opposed to using the tablets. Now, another strategy that is used is that if we believe that it is necessary for you to be on these medications, especially on a long-term basis, then we may prescribe medication to protect the stomach. And what these medications do is that they reduce the amount of acid production in the stomach and therefore decrease whatever inflammation in the lining of the stomach there would be, and decreases the risk of bleeding. So persons who are on these on a long-term basis may also be prescribed these agents to protect the stomach. There are another group of medications that they belong to the NSAID class, but they tend to have less effect on the stomach and less side effects overall. These include things like Mobic or Celebrex or Coxius, so persons may have received some of these prescriptions. They work in a similar way, but they have fewer side effects, but they tend to be much more expensive. So sometimes you have to strike the balance between these versus the older drugs. Now, other things that can be done if medications are not adequate, you can get injections in the joint, and this usually may be done by like the specialist rheumatologist or the orthopedic surgeon, etc. You can inject the joint, often with steroids, which are potent anti-inflammatory agents, and they can relieve arthritis symptoms for a time. But one still has to be careful with accumulated side effects and the number of injections that are given over a period. Another one that is looked at, I'm not sure how much it's available locally, but there are synthetic lubricants that can be injected into the joint. And these are usually similar to the natural compounds, but they produce them commercially and can inject into the joint, and that may relieve pain sometimes for several months. I'm not very sure if this is available locally. Now, other surgical therapies include joint irrigation, so they can wash out the joint, and there's some evidence that that is of benefit. You can do special procedures to realign the joint so that the bones match up a little bit better, and you can relieve pressure on particular areas. For some joints, you may be able to fuse the joints so that they no longer move, but that doesn't work well for all joints because sometimes the movement of the joint is necessary for regular movement. That sometimes is done like when you have arthritis in the neck or in the back, they can fuse some of the bones of the spine so that movement is restricted and therefore no further damage is done. And usually when those aren't adequate, the next option is joint replacement. And we have some pictures here that would help to illustrate. So what essentially is done is that the original joint is taken out and an artificial joint is put in. And these are now fairly commonly done procedures. Patients do fairly well afterwards. But of course, the procedures themselves carry risk, and the cost for the procedure, especially if it's being done in the private sector, can be very high, and therefore it's not our goal. But if you get to the stage where that is what is necessary and there are funds that can allow it to be done, then so it is certainly better than again continuing to suffer through it. Right? So joint replacement can be done. So that's a picture of the hip joint with the prosthesis, which is the artificial joint. And here's a picture of the knee joint. Again, where the old joint structures are removed and the artificial prosthesis essentially is inserted and will allow fairly normal functioning. No, it's not going to be as good as your original joint. Right? So we have to understand that there's limitations to human technology and so on. But certainly it's a major improvement compared to what persons had before. So these are clear options, and essentially if it is necessary, we walk by faith. That's how I look at it, right? So it's not something that you want to do, but if you need to do it and that is the solution and the Lord has opened up a way for it to be done, then you walk by faith and regain your mobility. Right? Just probably 2 more slides as we just to say a bit on rheumatoid arthritis. Now with this is primarily due to inflammation. So it's not the wear and tear that we see with osteoarthritis. And what is happening here is that your body produces proteins that attack the joints. And usually what has to be done in these situations that you now have to give more potent anti-inflammatory agents that tries to reduce the activity of these proteins to decrease the inflammation and therefore prevent some of the complications. The rheumatoid arthritis tend to be more common in younger patients and especially young women. And therefore, if you see persons, usually in their 20s and 30s with significant joint pain and stiffness, or their 40s, etc., as well, it can even have later onset. But whereas it's rare to see the osteoarthritis in persons in their 30s and so on. It's much more common in the rheumatoid arthritis is much more common among the younger persons. And one of the distinctions with it tends to be more symmetric and tends to affect the small joints. So you may see both hands are with pain and swelling in the fingers and the morning stiffness and so on. So the pattern is a little bit different, and therefore it's important to recognize this because again the treatments are very different. Another important issue regarding rheumatoid arthritis is that it may not affect only the joints, but may affect other organs, in particular the lung, and therefore has to be taken with a certain level of seriousness. It may lead to severe joint deformities as well, and therefore significant loss of function. For this one, it's important to get blood tests because blood tests are important in making the diagnosis. So usually it's difficult to make the diagnosis of rheumatoid arthritis without doing the blood test unless you see very classic features on the clinical examination. And again, in terms of the medication treatment, it's usually not just the anti-inflammatory. There are several other treatments which we won't go into tonight, but just to know that your Panadol and Aleve and Advil is not good enough if it's rheumatoid arthritis that we're dealing with. And often you may actually need to have specialist consultation with a rheumatologist. So a rheumatologist is a doctor that specializes in the disease of the joints. I didn't mention before, but for some of the more serious forms of osteoarthritis, certainly if you're going to do surgery, you need a bone specialist, usually is an orthopedic surgeon. So again, knowing the appropriate doctor, and sometimes you may have to ask to be referred because sometimes people are held back unnecessarily. All right, so just a few pictures looking at rheumatoid arthritis. So this one just shows the swelling and inflammation. Again, it's less wear and tear than one would see with the osteoarthritis. This next slide shows a hand affected. You can see some of the deformities, and there's, when you saw that blown up picture, shows there are lots of erosions in the bone and so on. And then more severe cases, again, severe joint deformities sometimes can result in very limited functioning of the hands because of the rheumatoid arthritis. So it's not a very pretty disease, if you want to put it that way, can have serious consequences, but there are a number of available treatments. Right, lastly, can we prevent arthritis? The sad part of the story is that we may not be able to completely prevent it because, as we said, it's a wear and tear problem. So while we know some of the risk factors, we can do things to reduce it, but we may not be able to prevent it completely. And certainly we don't know enough about things like rheumatoid arthritis to prevent it completely either. So a couple things, though, that may be helpful. Some studies suggest that eating diets rich in omega-3 may reduce rheumatoid arthritis, so the omega-3 thing comes back up again. Keeping a healthy weight, we have said this many times, right? So all the persons who are overweight need to start working on it, all right? So we try to ensure that we keep a healthy weight. Regular exercise will both strengthen the muscles support the joints, and therefore will put less pressure on the joint if you have good muscles. Avoiding injury. So be careful with what you're doing. So certainly, and this is even more for the young among us. So you are working in a construction setting, you're working in a factory, you have to lift weights, you have to do these sort of things. Be aware of the potential damage that may occur to the structures and begin to take precautions. Also things like using the appropriate techniques when sitting, when working or lifting objects. So think about those things so you can minimize the risk. We may not be able to prevent it completely, but certainly we don't want to contribute or to hasten the progression of the disease. So to summarize, arthritis is due to inflammation of the joints, causes pain, swelling, and loss of function. Commonly includes the osteoarthritis, or common types include osteoarthritis as well as rheumatoid arthritis, and there are several available treatments including our supportive care, physical therapy, medications, and surgery. So we have options, but we want to do as much as we can to prevent it in the first place. So we'll stop there, and I believe we have some time for questions so we can help to clarify issues that you may be facing and provide appropriate answers. All right, I see Sister Arlene's hand up already. All right, so that I probably don't have. The question is, how do you know when to use a cold compress versus a hot compress? I don't know if there is a specific. Okay. I think they want you to come so you can be seen on the recording. Yeah, so well, go ahead.
How do you know when to use a cold compress as opposed to a hot one?
All right. So as I was saying, that in terms of what one would tend to look at in terms of what you're dealing with. So usually when there is a lot of redness and inflammation, cold may be better. If it's more pain and general swelling, then there may be some benefit from the heat therapy as well. But I'm not necessarily the expert on that. So I would probably need to get some additional guidance in terms of heat versus cold in that. But certainly there are some things that one would need to look at. And again, if you have concerns, it's something that we can sometimes research and get the necessary answers for you. All right. Questions? I think Brother Dave shut down the questions, you know.
Sir, you mentioned that every now and then if you hear a click, how can you measure when you know? Because I know sometimes I lift up my foot and I hear some click, you know. So.
Well, so the issue is that if you hear a little click, it means something may be wrong. Again, it may be time for a checkup and to have some assessment done, because other than that, you may not be able to say for sure if it is something serious or if it's not serious. All right, good. All right, questions? Here's a question, yes?
Okay. When I was very small, my parents used to tell us that, like, if we like just finish ironing and go straight to the bathroom, we have the risk. There's the risk of arthritis or anything. Is anything like that?
That one I don't know.
The hot and cold. The significance of the hot.
No,
and cold.
put it this way: extremes of weather is not a good idea. So you don't want to just go from one to the next, right? So it is wise. But in terms of whether or not there's a specific relationship between your doing your ironing and going to have a bath, I can't answer that specifically. But then in general, I would say don't go from one extreme to the other. So cool down and then move to the next activity.
Okay.
All right. There's another question coming.
Dealing with these kind of elderly persons, just in terms of exercise, most times they ask us to use the bicycle, but yet they have problem with their knees. It's the safe thing to do.
All right, so the question is using like the bicycle. So the bicycle, if it depends on what level of pain and discomfort the person is having and how much damage there is. So clearly there is motion that is taking place. And if they're going to be doing it at fast pace, then that may be putting unnecessary pressure. Usually for persons who have arthritis, water therapy is actually one of the best forms of exercise because it gives you buoyancy, so the water helps to support the weight, but then that may not be accessible to everybody. So certainly, mostly what has to look at is the intensity. So if you're using something like an exercise bike, can they do it without experiencing pain? That's usually the first question. If you're experiencing pain while doing the activity, then you should revise the activity. And again, one would now have to be careful. You don't have to be going too fast, not necessarily too long, again, so that you can monitor and manage the kind of exposure and the kind of risk that one would have.
Bless the Lord.
Praise the Lord.
Is it true that that substance that is between the two joints, is it true that there are some foods that you can eat that can replace that substance, like okra? That's what I hear.
I'm not sure about okra. So in terms of, again, a lot of these, when people have the ideas, we would now need to go and research it and see if it makes sense, right? Somebody may just look at the okra and say, no, it has that particular nature and it looks like it's good for your joint, but I am not very sure. Now, there are some things, though, we mentioned like the omega-3s because it's part of the joint substance. So eating oily fish would be something that is helpful in trying to help to maintain joint health. So that one we can speak about. I'm not sure about the okra. But we can research it. So write them down and we can look it up and see if there's anybody who has done proper research on these subjects.
Sir, I have a two-part question. My voice is a little bit worse, but I guess you will hear anyway. You mentioned sometimes the types of work that we do. Sister was talking about the extreme. Like I work in the kitchen and sometimes I have to be washing and be over the heat and I'm feeling this pain in my joints. But sometimes because I am on the medication for high blood pressure, I do take aspirin every day, but they said it's coated, so maybe that helps a little with the pain when I take the medication. How does that?
So the issue would be, first of all, looking at the specific joints in terms of which joints are affected.
Like my fingers. my fingers, because you have to be washed. Remember, if you're working in the kitchen, every 15 to 20 minutes you have to be washing your hands. And you're over the heat and you're back in the water, and you have to be doing things, angling water. Sometimes it's cold, like you, taking up the chicken, which is very icy and all of that. So sometimes my fingers get, but as I said, taking certain other medication for other sickness, illness, then it sort of help, but I don't know, because they said it is coated.
Okay.
So the aspirin that I do take, it is coated, so I don't know.
So what we would have, I remember we said that the dose of aspirin usually that is taken is usually not strong enough to deal with joint pains. But going back to the occupational issues first, so one of the things that one would want to do is that you can do things that can help to minimize the exposure. So for example, wearing gloves may help that you have less direct contact with the cold, and therefore help to protect in terms of some of the exposure, and therefore sort of regulating what you do, so it reduces the extremes. And again, sometimes planning your activities to say, you know, you're going to do this at this time and this at that time, and then you move to that, may help in reducing the exposure. That is my kind of initial approach, because the main thing is that if you're in a job that may cause various exposures, then you want to minimize the risk by taking precautionary measures. And then, of course, one would now need to assess in terms of what exactly is the nature of the problem. Are there signs to suggest more serious types of arthritis? Usually,
sometimes the feet get a bit swollen and
yeah. So I mean, the best thing would be to have a more formal consultation, so you can go through the specific issues and then work through them. But clearly, one would want to minimize exposure, and one would want to make sure that in terms of we are not dealing with something more serious than just regular arthritis. Those are the kind of approach that one would take.
Okay, sir. Thanks much.
Yes, sir. According to the okra, I was walking and my knee was going coop, 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 coop. Yeah, coop, coop. But I didn't, when I did the okra, I didn't really do it because of the knee. I decided that I would boil, blend some string bean with okra and carrot, which I did. And I blend a good amount that I could. I just put it in the fridge, blend it with a little piece of ginger and put it in the fridge. And every now and again I would drink it. And then I realized that I don't have no kukum again. So.
All right, so that's fine, that's fine. So let me just put a little spin on this now. All right, so one of the things, so I work a lot in research, so the whole idea as to what constitutes evidence becomes very important. So what we have is what I'd call a testimonial. No, but it can be the start of some important discovery. So what we would now need to do, for example, is see if anybody else has had the same experience that you have had. You have... All right? And then when we find enough people with similar experience, then we can now begin to do a more formal study to see whether or not this is something that we can recommend. So we never ignore patients and what they say, because it is often important. But in order for us as physicians now to begin to promote any particular food or intervention for any kind of disease, we have to ensure that we have good evidence to support that it works. Now, you can tell your friend and your friend can try it, so that's fine, but then I can't promote it unless I have evidence to support it. All right? Good.
Yes, Dr. Ferguson. If the ferritin level in the blood is too high, can that cause arthritis?
Okay, so the question if something like the ferritin level in the blood is too high, that can cause arthritis. So it's essentially what happens is that that's usually due to iron overload. And what you can get deposition in various organs. So the joints may not be a common site of deposition, but certainly that is something that would have to be dealt with in a different way. So usually that's a different problem overall, usually due to excess iron. So I'm getting the wrap-up signal. So I will say thank you all for listening. Rheumatoid? Yes, actually you can, because there are two different pathologies. And so the wear and tear issues plus the whole inflammatory thing, it can co-occur. Okay, thank you very much. God bless.
Amen. We give God thanks for Dr. Ferguson tonight. Let's just give him a bigger round of applause. Amen. And as he presents, I realize I'm getting there. Sister Denise, look at me. The weight. Yeah. One thing, Sister Denise always lecture me about the weight, but I'm going to get there. I'm getting it. Getting it down. Amen.